Debate on vote number 18, Health Appropriation Bill.
I now invite the Honourable Minister of Health to introduce the budget vote. The Honourable Minister.
Honorable House Chairperson, my cabinet colleagues, ministers and deputy ministers present, Chairperson of the Portfolio Committee on Health, Dr. Sibongiseni Dlomo, and members of your Portfolio Committee, honorable members, distinguished guests, ladies and gentlemen, greetings. Let me start by apologizing for the absence in this debate of the Deputy Minister of Health, Dr. Joe Pasha, who is just arriving this morning in Johannesburg from a week-long work-related trip overseas. It gives me great pleasure to present the 2024-25 budget of the National Department of Health to this House, and also to outline plans for the 2024-25 financial year to the amount of 62,218,899 rand. This is 3.5% increase from the 60.1 billion of the last financial year. The details of how this money is going to be spent are well elaborated in the annual performance plan and the department. Hence, I'll move to other very important matters. Since being appointed to this department 11 days ago, various media houses have called to ask me to outline plans and priorities for the next 5 years. And even up to today, I'm still having a series of interviews lined up to this effect. And I guess my cabinet colleagues in other departments are going through same. For my part, I have given and will always give a standard answer, and that is for the health sector, priorities and plans have been outlined years ago by the supreme body of health, the World Health Organization. These outlined priorities of health applied globally to any minister of health who can vary them as they wish. But according to the World Health Organization, a health system anywhere in the world consists of 6 building blocks. You may call them pillars of healthcare if you so wish. And these are, I'm not necessarily putting them in order of importance or priority, but I'm just naming them. And these are leadership and governance of the healthcare system. 2, access to essential medicines and other commodities. And 3, the health workforce, which you usually call human resources, the soldiers who must go into the trenches of healthcare. 4 is health financing system. And 5 is health information system. 6 is health service delivery packages, the packages through which individual members of society receives healthcare. These building blocks have 4 goals and outcomes which must be recognized and felt by all and sundry in a particular country. And the 4 goals and outcomes are: number 1, an improved health, both level and equity. Number 2, responsiveness. And number 3, financial risk protection. And number 4, improved efficiency. 5 of these 6 building blocks mentioned above seem acceptable to everybody, and debates around them are straightforward and clear. But one of these 6 building blocks has generated a lot of heat and sometimes fury in some quarters. And this one is called health system financing, as I said. In our country, we've decided to call this health system financing National Health Insurance, or NHI. Some believe that NHI is a health system which South Africa is not ready for. Others believe it's a vintage, very expensive health system for which there's no money in the country. But let's clarify ourselves, colleagues, honorable members. NHI is a health financing system, period. It is called universal health coverage by the World Health Organization. It is a health financing system which is meant to equalize between the rich and the poor. There's no debate at all that South Africa is the most unequal society in the whole world. If you want to see what inequality means, come to the health sector in South Africa.
And there's a loud silence.
Honourable Minister, apologies. May I request the members or those who have access, table staff, translators, to be mindful that this is not a virtual sitting or hybrid sitting that is taking place. It's a physical sitting of members of parliament, so there should not be any disturbances on the floor. Please proceed, Honourable Minister.
There is no debate at all that South Africa is the most unequal society in the world. And if you want to see that inequality or what inequality looks like, you come to the health sector. Within the borders of the same country, some are getting world-class health care, while others get such a poor health care, we may believe we live in different countries. We can no longer, with our eyes open, sustain such gross inequality. If there is something we can do about it, we must do it now and not in the distant, ill-defined future. On the 23rd of May, 2012, the former Director General of the World Organization, Dr. Margaret Chan, officially opened the 65th session of the World Health Assembly in Geneva, in Switzerland. She chose universal health coverage as a theme. She outlined the global structural problems of healthcare, and she mentioned 7 of them, of these structural problems. She named 2 of these 7 as relating to the financing of health in the world. And I quote, she said, one of the structural problems is costly private health care for the privileged few, but second-rate care for everyone else. And 2, that some countries have devised schemes for financing health care that punish the poor, close quote. House Chairperson, if you want to see costly private health care for the privileged few, but second-rate care for everybody else, come to South Africa. If you want to see schemes for financing health care that punish the poor, you also come to South Africa. No way can we, with our straight faces, continue in this manner. I'm painfully aware that in this house, I'm standing in front of human beings who fall within this category of a privileged few, who receive costly private health care, unfortunately at the expense of the poor. Painful to say, but unfortunately true. And honorable members, time to change has arrived. Ironically, it is actually the privileged few who are called upon to usher in the change. And House Chairperson, as public representative, we dare not claim that we don't know the history of our country. Our country has been seeking solution to equitable financing of healthcare for the past 96 years. There are people who believe we started after democracy. It's 96 years, and yes, I'm not making a mistake. We've been looking for this solution for the past 96 years. And this is recorded in history, and history cannot just be erased. History records that in the 1928 Commission of Old Age Pension and NHI, the 1941 College Committee of Inquiry into NHI. The 1943 African claims that proposed equal treatment in the scheme of social security. The Dr. Henry Clarkman National Health Service Commission of 1943 to 1944, which proposed NHI as the solution. The Freedom Charter, as adopted by the Congress of the People in 1955. The 1994 Ministerial Committee on Healthcare Financing. The 1995 Ministerial Committee of Inquiry in NHI, the so-called Bloomberg and Shesani report, the 1997 Social Health Insurance Working Group, the 2002 Committee of Inquiry into Comprehensive Social Security, the so-called, what's called the Taylor Committee. Not to forget the Charter of Health under 1943 African claims in South Africa that had advanced for major transformation of the system, even under British colonization. House Chairperson, what we have been doing in the past 96 years was to keep on sharpening the spear for change, but not using it. In isiZulu, they say, umkhonto wegwala uphelele ijele. Even today, we are going to argue that we are not yet ready to implement. We are going to argue that the spear must continue to be sharpened and that we need another commission to tell us what's wrong with our healthcare system. Honorable House Chairperson, we know what is wrong, but we are not just willing to tackle it because we belong to the group of the selected few. We are beneficiaries of a wrong system and we dare not meddle with our own comfort. House Chair, in order to understand just how important healthcare financing is, go and read the editorial of The Lancet of September 2013. The Lancet is a British medical journal, one of the 4 best and highly recognized medical journals in the world. The Lancet argues that since human beings started populating this planet we call Earth, health has undergone only 2 global transitions. The first transition is called the demographic transition. It began in the 18th century and changed the planet in the 20th century through public health improvements. That is a very simple thing, not complex. Simply clean running water, basic sewerage, and sanitation. I'm sure we take them for granted today, but those of us who are in healthcare, we know how they change the planet. This helped to reduce premature death greatly, and life expectancy improved in leaps and bounds. The second transition, according to the Lancet, is called the epidemiological transition, which began in the 20th century and eventually reached even the most challenged countries in the 21st century. This is what we call today immunization or vaccination. Communicable diseases, starting with smallpox, which annihilated more than 300 million people globally since 1900 alone, were vanquished and controlled in a scale never imagined. The demographic transition and epidemiological transition changed this planet irreversibly. Now the Lancet goes on to argue that the third transition is upon us. It is called universal health coverage. The Lancet argues that this great transition seems to be sweeping the globe and it's about how healthcare is financed. You'll realize that in the transition, I'm not mentioning a great change that has happened in the country, in our own country, I mean to say. The heart transplant by Dr. Christian Barnard, a few paces from here where we are, at Grooteskill Hospital. I'm not mentioning it in the transition. It's not because it was not great. It was very great. But the transition that I mentioned by the planet, the Lancet, changed whole population, not individual human beings. They changed the whole population and humanity forever. And that's why they are mentioned. Now, when the Lancet said this, that the third transition is coming, and it's called universal health coverage, it was 11 years ago. But there seems to have been a big pushback from the rich as it is now happening in our own country. There's a pushback that we dare not go in that direction. even though everything in history points that we need to. Now, what is wrong with the present health financing in our country? The World Organization has declared that a country to have a good healthcare system for everyone, regardless of their financial status, that country needs to spend at least 5% of its gross domestic product on health. Colleagues, this is not 5% of the budget of a country. It is 5% of the gross domestic product, the total wealth of a country. Now, in South Africa, we have far surpassed the recommended 5%. We are at 8.5%. On average, European countries are at 9%. This means our health system was supposed to be as advanced as the healthcare systems of countries in Europe, because we are within the same WhatsApp group when it comes to how much of our wealth goes to health. As is evident, this is not the case. And why? Here today, we'll be provided with many reasons to make us feel comfortable and less guilt, feel less guilt. But the fact remains that there are gross inequalities in which this wealth of the country is divided. 51% of this 8.5% of the GDP goes to serve only 14% of the population. And the remaining meager 49% serves a whooping 86% of the population. Everybody agrees that we are the most unequal society. And this just proves it. And House Chairperson, I think we ought to stop this. It needs to end, and end now. Now, here today, one is going to hear colleagues standing up and say, of course, I do support universal health coverage. I haven't heard up to now anybody in South Africa who says they don't support universal health coverage. But there's always a but. I support universal health coverage, but. And the but is going to be that the country is not ready. The public sector is not working very well. It has got no management. There's corruption and all that. That is true and fair enough. But we cannot throw the baby away with the bathwater. We need to find solutions. We can't say this system is good, but because it has got this and that, which things can easily be resolved, and then just throw it away. Let us discuss the areas that need to be ironed out. And we've done so before as South Africans. We've done so in 1994. We are doing so today after the results of the elections, which were not what any party was expecting. And we've been able to show that we can resolve problems if we wish. Now, colleagues, I wish to let you know that the argument that is always forwarded, that we must not meddle with private healthcare because this money is private and comes from pockets of individuals. Is that true? For those who don't know, yes, this seems like that. But for those of us we know, really, is this private money? Let me give you the figures. Our government, the state, subsidized private healthcare for the rich in a way unimaginable. 1.3 million public servants, plus all members of parliament, honorable members standing in front of whom I'm standing, and honorable members in legislatures, and all the judges of our country are subsidized by the fiscus of this country to the tune of 70 billion rand per annum. This comes in the form of medical aid subsidy in your salary. It is 70 billion, yes. And any person in our country who is on medical aid, regardless of who is their employer, they receive tax rebates from SARS. And I'm made to understand that these tax rebates amount to about 30 billion. Hence, 100 billion rand of the fiscus goes out to subsidize us, the rich, and leave the poor out. And we all know that at the end of the day, this money gets exhausted somewhere around September and October. And we, the rich, go back to the public healthcare system at no cost and demand help. But the poor person who doesn't have a medical aid, even if the help they need is in the private sector, they cannot go there. So we, the rich, we are double dipping, and we found nothing wrong with that. Let me give you some other figures. Let's start with life. Every year, 1.2 million women fall pregnant in this country. Put differently, 1.2 million babies are born. Who is taking care of them? The private sector, with this huge resource, takes care of only 140,000. The whole 1,060,000,000, they go to public healthcare system.
Honorable Minister, your
Where
time
they
has
meet
now
the
expired.
resources. Thank you very much.
Thank you. Before I call the next speaker, may I request the chamber staff to ensure that we have waiting chairs on both sides so that the speakers who follow can move from their seats timeously so that we do not have undue delays waiting for members to come from the seats where they are seated. The next